I'm Frank Diamond, the managing editor of Infection Control Today. We're helping infection preventionists and others on the front lines battle COVID-19. Joining me today is Deborah Chung. Ms. Chung is the healthcare marketing manager for Essity North America, a hygiene and health company. Ms. Chung recently wrote about hand hygiene for Infection Control Today, and you can check that out at infectioncontroltoday.com. Ms. Chung, thanks for joining us today.
Thanks for having me.
Hand hygiene, it's been a problem for decades. People don't practice it enough. Healthcare workers, in study after study, they don't practice it enough. Do you think COVID-19 is going to change that? It's going to change how people practice hand hygiene?
Absolutely. Even before COVID-19, there was a study done where 8 out of 10 healthcare workers wanted to receive better hand hygiene training. And proper hand hygiene training is the #1 way to reduce the spread of illnesses and viruses, including COVID-19. And given these unprecedented times, it's more important than ever to reinforce and control the spread of not only COVID-19, but any other illnesses.
I took a look at the guidelines set out by the World Health Organization about how proper hand hygiene should be done. And as one of our experts said, now you can do that and still maintain a pace where you can actually help your patients. Good luck, because it's pretty involved process. And we're talking about busy healthcare workers. So is there a balance that has to be weighed there?
World Health Organization's recommendations for hand hygiene is before and after touching the patient, before and after cleaning a procedure, and after bodily fluid exposure. So that can just, that performance of hand hygiene can incorporate sanitizing or hand washing. So no, and if that means protecting our patients more and reducing the pathogen transmission for up to 50%, I don't think that 20 to 30 seconds is too much to ask.
It's not, and yet, at least until this point, it wasn't done properly by enough healthcare workers. What do you think's going on there?
Even before COVID-19, proper hand hygiene compliance, it's very low. When we did a survey a couple of years ago, 40% of healthcare workers wanted better hand hygiene training, because we all think we know how to perform it, but are we doing it accurately? No. So with the 40% wanting better hand hygiene training pre-COVID, I can only assume that's been exponentially surged. There's virtual reality trainings that can help simulate different scenarios of hand hygiene compliance. You can put up signage. You can have optimal dispenser placement of sanitizers to reinforce hand hygiene. But I think right now more than ever, the education of hand hygiene is very important.
And how would you go about educating healthcare workers about hand hygiene?
Virtual reality apps are readily available. They're very effective in reinforcing the World Health Organization's 5 moments of hand hygiene. Also signage, increasing signage throughout a facility. Studies also show 8 out of 10 patients indicate the presence of hand hygiene signage makes them feel more comfortable and safe about the facility's cleanliness and quality of care. So having signage throughout your facility can reinforce visually to your healthcare workers as well as your patients the importance of hand hygiene.
And, well, you know, human nature being what it is, and people rushing from one patient to another, do you think once there's for instance, a vaccine for COVID-19, once COVID-19 gets out of our lives for good one way or another, do you think people will just revert to just the way? I mean, I'm asking you to predict what human nature is going to be like, and that's a pretty big prediction. But
yeah,
are you hopeful that hand hygiene will improve even after COVID-19 goes away?
I do believe the world is never going to be the same, whether it's a good or a bad thing. You know, I can't predict the future, but even when COVID-19 was surging in North America, people were stocking up on sanitizers, bleach, alcohol. I think hand hygiene will never go away. I think moving forward, it's going to be more implemented. I think the social distancing aspect, I think being hypersensitive to hand hygiene is it's the new norm.
What role do you think infection preventionists and hospitals have in trying to improve hand hygiene in their particular facilities?
I think they have a very important role. Their relationship with EVS technicians and the departments, making sure that they have the right tools that they need to effectively keep patients and visitors safe and hygienic. Their role is to inform the team of what solutions best disinfect and surface cleaning, on how to surface clean. But they have a very important role as far as keeping our healthcare facilities hygienic.
Who has the hardest time in hospitals maintaining hand hygiene standards? Is it nurses? Is it doctors? Is it environmental services teams? Is there any studies that you've seen that kind of pinpoint where the problem lies mostly?
I haven't seen any scientific research or research done around who has I guess, the hardest time maintaining hand hygiene, but I think they all equally have an important role to play to reduce the spread of illnesses and hospital-acquired infections or healthcare-acquired infections. EVS being on the front line of our healthcare workers, I think they do play a significant role in reducing the spread of illnesses as well.
How'd you get interested in this subject, hand hygiene?
It's perfect timing, right, with COVID-19, but it's something that we all think we know. We know how to do. We do it multiple times a day. I think a study said there's 5 billion hands that need to be washed daily. But are we doing it efficiently and effectively? And I can only assume that percentage is probably not well enough. So my goal and mission is to make sure everyone knows how to properly wash their hands to protect our loved ones and our friends and families. And right now is the best way to promote that right now.
Do you see any new technology on the horizon that would help in ensuring that hand hygiene standards are maintained?
There are some in the market today, and I can only imagine it's going to be more readily available. In healthcare facilities, they have monitoring tools of monitoring hand hygiene compliance. So whether it's a sanitizer with a monitoring tool to monitor when a healthcare worker goes inside a patient room, that they are using the sanitizer dispenser. Whether it's exiting the room, entering the room, the bathrooms, it's a hand hygiene monitoring tool, which I think more facilities would implement moving forward.
It seems that when healthcare workers are removing, donning and doffing their personal protective equipment, that's disinfecting their hands seems to be part of every step of doing that all the way.
Yes, it's just like before and after touching every patient, you are sanitizing or washing your hands, donning and doffing PPE as well.
What's the best tool that you've seen that that instructs people on the best way to take care of their hands, wash their hands?
I would defer to the CDC, their guidelines and regulations. TWORK, we also have a tool, a Safe at Work toolkit that outlines our mission and our goals for reducing the spread of COVID-19 and how to properly be compliant with hand hygiene and surface cleaning training.
Do you think there's enough sinks and sanitizing dispensers in hospitals now to help in hand hygiene?
I think in healthcare facilities right now, that's a subjective question, depending on your rural or urban setting. But I would have to do a little bit more research. But I think what we have now could get it should be enough to get the job done.
Who sets the benchmark as far as hand hygiene? I mean, what institution? Is it Johns Hopkins or Cleveland Clinic? You probably looked into institutions and their hand hygiene protocols and what they do. Anybody come to mind?
We usually follow our collaboration with the World Health Organization. They, in partnership, they set the guidelines for the 5 moments of hand hygiene, and that is before and after touching the patient, before and after bodily fluids, and before and after cleaning aseptic procedure.
Any advice for infection preventionists about how to better spread the gospel, as it were, of hand hygiene among their fellow healthcare workers?
I think just repetitive education and training, and they want leading with doing. When you are performing hand hygiene in front of your colleagues, your coworkers, friends, and families, I think that's the best way to set an example. Yeah, leading by doing, I would just highly encourage right now in training.
When do you think the news? Do you think there'll be news standards created as a result of COVID-19 about hand hygiene? I mean, will they change the way it's done now? You said 30 seconds, singing happy birthday twice. Will that change at all? Or you see any rumblings that might change?
That the 20 seconds of hand hygiene or hand washing and hand sanitizing, that has shown effective of killing 99% of the germs and illnesses from studies done. So I don't know what type of conversations they're having at a higher level, but I think that is very sufficient for now.
Okay, anything you want to add about hand hygiene for my readers?
No, wash your hands, protect our friends and our loved ones, and stay safe, everyone.
Okay. Deborah Chung, thank you so much for joining Infection Control today.